I'm Gilda Cobb-Hunter. I'm president of the National Black Caucus of State Legislators, and we are really thrilled with the guests that we have today. And because I want to make sure that there is time for our guests as well as for those of you on the line, I'm going to just give you their names, well, you can see their names, but just tell you that we've got a wealth of information here today. And I'm sure the title of this webinar, Show Me the Money and How to Get It, is one that caught your attention. Hopefully, at the end of these 90 minutes, you'll be able to at least figure out where it is and maybe halfway figure out how to get it. And included in that, of course, is this whole notion of unemployment. But before I go further, let me, if I may, turn it over to my colleague, Mr. Senator James Sanders, Jr., the Honorable Senator, Chair of the Banking Committee for the New York General Assembly. And Senator Sanders, the floor is yours.
Thank you very much. I trust you can hear me, Madam President.
We can, sir.
Thank you. It's a joy to be in your midst. It's a joy to be in the living. The studies came out yesterday, and it said that my district has the highest rate of COVID deaths in New York City, which makes it the highest in New York State, which makes it the highest in America. Great distinctions. I'd rather have the lowest, but I have the highest. But this is just a fact. Now, what do we do with facts? One of the things that comes from this is that it's understood that I am in a health desert, that I am in a situation where every problem that there is, we have. So that means that we can only go up from here, or we can stay on the ground. To go up ultimately means that we need to find the resources. We are actively looking at the next step from here. We're not waiting till the illness has passed. We are looking at how do we ensure that the adequate monies come. We are creating what we call Vital Southeast Queens, and that means that we are creating the coalition of philanthropies, of government, of other monies that will target the problems. So what you are and your guests are doing, Madam President, is urgent. We can sit still and we can say how bad a thing is, or we can do something about it. And our organization is one that believes in doing something about it. So I've been delighted to say these brief words and to commend all of you presenters and everyone who is listening for having a foresight to know that it's better to hit back than just to be hit. Thank you, Madam President.
Thank you so much, Mr. Chairman. Appreciate those words. And you're absolutely right. Thank you for the great work you're doing in New York. And let me take a minute before I recognize our first panelist, just as background to share with you that the National Black Caucus of State Legislators has created a COVID-19 work group. We've been working for about 2 months now, and these webinars are part of the work of that group. We've done one. The first one we did last month was on public health, just trying to encourage legislators to understand what this issue is. This one, of course, a part of the recovery, where's the money and how to get it. Our next webinar will engage the education community. We are talking about going back to school and those kinds of things. And then a final webinar that we will talk about solutions. We have with us today to talk about the federal COVID-19 response and resources for states panelists, a young lady who is not a stranger to some of us. She used to be a part of the South Carolina General Assembly, working for the South Carolina Senate, and she is now moved on up as they say, to bigger and better things. Miss Erlinda Doherty. Erlinda, it is great to see you today, and thanks so much for being a part of this conversation. And we know that you are going to share with us everything that our members need to know. And before I shut up and Erlinda start, let me welcome NBCSL members, NBCSL Corporate Roundtable members, NBCSL Labor Roundtable members, and just friends and supporters of NBCSL. Ms. Erlinda, the show is yours. Thank you.
Thank you so much, Madam President Cobb-Hunter. It's wonderful to see your face, even if it's on a screen, and it's a pleasure and an honor to be able to address the National Black Caucus of State Legislators. As you know, I do have a history with the great state of South Carolina, so my heart does rest with exactly what the states are going through right now. I may be in DC, but if you will, working at the state level, so I completely understand and acknowledge and can empathize with the challenges that states are facing right now on the front lines of the unprecedented pandemic. So thank you for that intro. And I guess we can start the slides if that's okay. And also want to acknowledge all of the legislators that are here today, and the staff, and of course the corporate sponsors that are all that continue to support the NBCSL. At NCSL, where I'm coming from now, I am the director of budget committee, and my role at NCSL is to, along with the other directors there, is to be the voice of the states, the voice of the 50 states, representing your interests before the federal government. And never, in any other time that I can remember in my life, is now more, is probably even more the role that we serve and can serve for you all and representing you all before the federal government has never been more, I think, than it is currently. So again, I am the director of the Budget Committee, so my account, or my slew of issues that I handle, encompass everything having to do with the money. So, and of course the bigger picture with federal appropriations, anything to do with taxes, revenue, and how that trickles down to the state level. So I'm going to be giving you sort of an overview, of the federal response to date. And while I'm not an expert in some of the other areas with respect to education funding and health funding and things like that, I'm happy to turn you over to, or provide sort of the bigger map, but then also provide you with expert resources at our organization that are there to help you with that. So, so next slide, please. Great, thank you so much. So, friends, where are we now? It's an unprecedented time, as you all know. We're also getting used to this post-COVID world, and so is the federal government, and trying to help provide resources for states. So where are we now? The House just passed a $3 trillion relief package, dubbed the HEROES Act. And again, it is not a huge chance of this bill being passed in its current form. It's got $1 trillion in there for an additional direct aid to states. There is this chorus, and that is well documented by data that we have at NCSL and our other organizations that we work with, to show that states are going to be suffering at a minimum 15 to 20% revenue shortfalls going forward, which my colleague Erica will talk about later. But this is the House passed version is an attempt to acknowledge the fact that states will be, in addition to the other economic and public health effects, will be faced with this unprecedented catastrophic hit to states' revenue bottom lines. But in addition to this sort of House passed version or HEROES Act that just happened last week, which is HR 6800, we have passed already 4 additional phases of legislation and measures for the federal government to states. Phase 1 provided more than $480 billion business loans, hospitals, and virus testing. Phase 2 more than $2 trillion to support the government's response and additionally help businesses and individuals in the economic downturn. Phase 3, which has been dubbed the CARES Act, continued to provide additional stimulus, paid leave, tax credits, and so forth, assistance and free testing. And what I like, phase 3.5, which provided additional $8 billion for health and replenished what we've been calling the PPP program for businesses to help provide loans to keep their staff employed. Next slide. So here is sort of a graphic depiction of the federal legislation so far. So again, round 1, the Coronavirus Preparedness Supplemental Appropriations Act, which was basically a supplemental appropriation, the initial phase of fighting the virus. Round 2, what we call the Families First Coronavirus Response Act. Phase 3, which is the biggest one so far, the $2.2 trillion CARES Act. And then what I call, again, 3.5, which was just about a month ago, the Paycheck Protection Program Enhancement and Healthcare and Health Enhancement Act. And we'll talk a little bit more about those going forward. Next slide, please. This is, again, sort of a graphic depiction of all of the funding that has gone through the various federal agencies through to the states in bigger chunks. You can see there most of the funding at this point has been through HHS, with the CRF, the Coronavirus Relief Fund, which I'll talk about a little bit later, being the second largest pot of money. FEMA, of course, has gotten a good amount to the emergency management agencies and to also for state of emergency, transportation, education next, agriculture, and then other together in a big group. Next slide, please. And one of the things that that has been our mantra with any of the funds that we've been advocating for the states has been flexibility. Now, the end result is not necessarily always in our favor, but no matter what advocacy efforts we are putting out there, no matter what communications, whether it's through letter form, whether it's through meetings, whether it's through trying to galvanize our state legislators like yourself to contact congressional delegations, the mantra has always been flexibility. To give states the maximum ability to make use of the funds that are trickling down to the states. Now, again, the end result is not always in our favor, but that is the continuous message that we're putting out there. So when I go forward in talking about some of the funds that have gone down, there has been some flexibility included that we're pleased about. Of course, there could always be more, but there has been matching funds that have been waived. Some transit funding that has been deemed flexible. The Governor's Education Relief Fund has been, more positive in that respect, and FMAP in the Families First Act, not in CARES, but in the FFCRA that is at least given some flexibility to states. We'll talk a little bit more about the Coronavirus Relief Fund as we go forward, as that has been a big issue and a big chunk of money that we were hoping would be more flexible for states to use to make up some of their revenue shortfalls. Has not exactly been the end result, but anyway, we'll talk about that a little bit more. Forward, please. Next slide. Again, sort of a breakdown again of phase 1, which was the initial round of funding that went out to the states. March 6th, you can see sort of the breakdown of the funds there. $6.5 billion in total went to HHS. To help fight the virus, and then it also enabled the Small Business Administration to provide $7 billion in disaster loans, and did waive Medicare telehealth restrictions to allow states to provide health care through safer social distancing mechanisms. Next slide. Phase 2, which was again the FFCRA, really was anchored by this notion of paid leave, really tried to give businesses and employers the ability to allow their workers to stay home and be safe while keeping their businesses afloat. You can see some of the details there. You can always ask me questions at the end of this program with more specifics, but phase 2 was truly anchored by this notion to give businesses, small businesses especially, the ability to keep their workers at home and to be safe as we were trying to mitigate the earlier stages of the virus. And as you can see here, the paid leave is financed through refundable employer tax credits. And it did include employer health insurance premium costs, and there was also a similar credit for self-employed workers. Next slide, please. Other highlights of phase 2 of the Families First Act were unemployment insurance, as much as $1 billion for states to pay for unemployment. Nutrition funding there to an additional $500 million for WIC, you know, to continue to be able to provide meals for those that needed them, as well as waived federal work requirements for SNAP eligibility. And then finally, increased Medicaid funding by 6.2%, required coverage of tests and related services without cost sharing, and another $1 billion to reimburse provider costs for testing the uninsured. Next slide. Now, the biggest so far package or response effort by the federal government has been phase 3, or what we call the CARES Act. This truly was an unprecedented amount of money and resource that were provided to the states that needed it for sure. $2 trillion in relief and what we also call stimulus, because it also did provide actual money in the form of stimulus payments and stimulus checks to individual taxpayers to keep money in their pockets to allow the economy to continue to function and to move. So it was not only relief, but also, and in the form of loans and assistance, but also actual cash that citizens could use to do what they needed to do to pay their bills, to get the resources they needed to keep their families and their businesses afloat. So again, here's a breakdown here, you know, $500 billion for loans and assistances, $349 billion in low interest forgivable loans in what we call the Paycheck Protection Program, payments of as much as $1,200 to individual taxpayers, what we call our stimulus checks, an additional $600 per week for unemployment benefits, $150 billion to state and local governments, and I'm going to get into a little bit more in the next slide, but the the CRF, the Coronavirus Relief Act, and then notably a suspension of Medicare sequestration through the end of the year until December. There was also an additional $340 billion in supplemental appropriations with the breakdown there, $140 billion for health and human services, $46 billion for for the Homeland Security Department, and another $36 billion for transportation. Next slide. So again, phase 3 included this coronavirus relief fund, which has been something that we've been tracking very closely and that I've been tracking and advocating for since the beginning of the virus, or efforts to mitigate the virus. It provides $150 billion in direct aid to states and territories for expenditures incurred due to the public health crisis. Anything COVID-19 related, and distribution is based on population, with no state receiving less than $1.25 billion, with 45% of the state's funds set aside for local governments with a population over $500,000, or people, I should say, and those localities were able to apply directly to the Treasury without having to go through the states. Again, we call this the CRF. Next slide, please. Funds can be used for costs that are necessary expenditures incurred due to COVID-19. Were not accounted for in the budget most recently approved as of the enactment of the section. So we acknowledge that, or at least Treasury tried to acknowledge the fact that there were several states that already passed their budget before this happened, that were incurred during the period that began March 1st, 2020 and ended through December 30th, 2020. But again, much to our dismay, Treasury was very explicit in that this fund was not, or the funds or the monies coming through this fund were not to be used for lost revenue, which was something that we were advocating very strongly for. Next slide, please. There has been some updates to the guidance coming out of this fund, most recently on 22nd April, but then also a frequently asked question document that came out on 4 May that did actually outline some other uses for the funds. A lot of states and localities had questions about it. We were acting as the liaison between the states and Treasury to get answers for all these different questions on how states could use the funds to in the way that benefited them the most and were most with respect to the limitations on the fund. Again, still no flexibility to be used for revenue shortfalls, but there was some clarification and confirmation of the funds in that they could be used as cash flow loans, funds for emergency legislative sessions, which I know were really, that was definitely a huge benefit for some states to be able to use it for that. And then also some states were going to be creating some programs to give loans to small businesses that may not have been able to benefit from, for whatever reason, through the Paycheck Protection Program. So that was also something that Treasury had acknowledged was an acceptable use of the funds. So again, I'm happy to answer more questions about this later, but we did sense an acknowledgement by Treasury to try to expand the use of the funds in the CRF to be more utile for the states. Next slide. Okay, and then here's some of the tax provisions that were outlined in the CARES Act. As you can see here, quite a bit of tax changes or tax revisions, and amounting to over $591 billion over a decade. And now here's the list here. And again, if you have more questions on that, we can delve into those later. But as you can see, a pretty big list of tax provisions and tax changes that went into effect with the CARES Act. Next slide. And again, Treasury did receive $500 billion for loans through the Exchange Stabilization Fund. And you can see sort of, again, the breakdown for those here. $25 billion for passenger airlines and related firms, $17 billion for businesses critical to national security, $454 billion through the Fed to set up what was called a municipal liquidity facility, which I know was sort of interesting to some states too, that had the ability to implement that program. It said, basically provide financing to small and mid-sized businesses in states and municipalities through states that could actually benefit from that program. And then some other, restrictions here, as you can see on this slide. Next slide, please. Great. Also, part of the CARES Act were more increases in jobless benefits. It did expand unemployment assistance, including an additional $600 per week, federal unemployment benefits, and as long as 39 weeks of pandemic unemployment benefits made available. You can see the provisions there, and an additional 13 weeks of pandemic emergency unemployment benefits for individuals that did exhaust their benefits through December 31st. And federal funds would cover the cost of unemployment benefits for this period. Next slide. Medicare payments too and health extenders were also addressed in the CARES Act. So again, this was a huge, huge package covering multiple areas here. Increased Medicare payments, you can see again, HHS programs that were extended through November 30th, DISH payments, community health centers, abstinence education, TANF, also extended through November 30th. Also an additional $1.3 billion to community health centers, and further expanded access to telehealth, including rural clinics. Next slide. Student loan payments were paused, more school aid relief. As you can see there, the Education Department granted waiver authority for school matching requirements, repayment of grants and loans, institution eligibility and allotment reporting requirements for education, as well as the $30.8 billion Education Stabilization Fund, which definitely was one of the few areas where we had seen some flexibility that was given to states to be able to use federal funds to help benefit the complete revision states had to do to get online schooling happening and virtual learning happening for students. Next slide. Banking rules were waived as well, and some consumer relief were also included in the CARES Act, as you can see there. Next slide. Okay, what I like to call phase 3.5. So this was just about a month ago now, as you can see, April 24th. Sort of a mini interim package they've been describing this as, because it wasn't exactly another sort of all-encompassing stimulus package. And again, we're advocating at NCSL for an amendment to the CARES Act, actually, that would allow for that CRF fund that I made mention to before in some detail, to allow for the addressing, or for those funds to be used for addressing revenue shortfalls in states. It was not, however, included in that measure, but the Paycheck Protection Program was replenished. That program, as you may have heard, had run out basically in the first 2 weeks of its implementation. So an additional $310 billion in lending authority was provided in what I like to call phase 3.5. Another $60 billion was set aside for loans to be issued by small lenders, and again, another $10 billion for disaster loans, and this was sort of a new program, and another $50 billion for SBA guarantees under their traditional disaster loan program. So again, while it wasn't the huge sort of all-encompassing package and did not address the big state and local gap that we've been talking about now, you know, there was some attempt here to help give businesses and individuals some sort of relief, and to give some of those businesses that were not able to take advantage of the PPP during its first disbursement of funds, it did give them more opportunity to be able to participate in this program. Next slide. Again, more funding for hospitals and testing as well in phase 3.5. $75 billion included for healthcare providers, funding that would go to public entities, Medicare, Medicaid, to help continue to provide more diagnosis, testing, and care for individuals with COVID-19, and an additional $25 billion in funds specifically for COVID-19 testing to be distributed in the way that you can see there for states, localities, and territories. And also it did require some HHS reporting requirements with respect to demographics and testing strategies. Next slide. Okay, so phase 4, question mark. This is sort of where we are right now. As I've mentioned, and I will be out of breath by the time I will stop talking about it. You know, we at NCSL continue to advocate for and encourage and urge Congress to provide additional funds to states to help address this revenue shortfall, which again, my colleague Erica will address a little bit later on today. But we have you know, continue to advocate for. We've written several letters now. The major one with NCSL's, you know, backing to provide at least $300 billion in direct aid to states. I know that the NGA has come out and said $500 billion. So several of our other local government associations have come up with their own numbers, but there is still this unacknowledged you know, need for states to have this direct aid. So, you know, we continue to advocate for that, but the timing of this and scope of this package are sort of unclear. The administration and the majority in the Senate has expressed that they, you know, are sort of taking a pause right now, trying to wait and see how the funds that have been dispersed to states are sort of working its way through states and their systems right now. But the Democrats, as you know, as I mentioned earlier, you know, passed the HEROES Act last week that does ask for, you know, $1 trillion for state and local governments for both virus expenses and revenue losses, more direct financial assistance for individuals, expanded SNAP and unemployment benefits, and more protections and payments for essential workers. You know, it has basically been said that this bill in its current form is DOA in the Senate, but at least it is a marker for which negotiations we hope can take place moving forward. Next slide. Again, just a little bit more about the background on that. There is bipartisan interest in infrastructure. President initially called for $2 trillion for that. So we're just trying to see how any sort of infrastructure priorities are going to be factored into any coronavirus phase 4 package, if you will, that may or may not happen. Next slide. And this is just some sort our NCSL resources that we have, like the like you all. We also have a web page that we update constantly with information for states with respect to resources that are out there with federal funds, but then also federal action. So we do encourage you to check our website out. You know, where we do post all of our up-to-date information that we have available for you. So. With that being said, that is all of my formal presentation notes I have right now, but of course willing to take any sort of questions that you may have at the end. Next slide. And again, here are our contacts at NCSL. Again, I am more of your general sort of appropriations, federal, CRF contact person, but if you do have specific questions with respect to the various other areas, education, agriculture, and employment and health, those are my colleagues at NCSL that are the experts that can definitely help get you the information that you need, but I'm also happy to be the conduit for any other questions and information that you need going forward.
Okay,
And that is,
good
I
job,
believe, all that I
Erlinda.
have today. Oh, thank you. Sorry. Thank you so much, friends. I appreciate it. Thanks.
Erlinda, thank you so much. That's a lot of information. For those of you on the call, please know that this information will be made available. It will be posted on NBCSL's website. And Erlinda, one of the questions that came through, I'd like you to be thinking about, a part of our job is as advocacy organization, is an advocacy solutions-driven organization. And we had one of our participants want to know if it's possible for NBCSL and NCSL to encourage the Congress to look at Medicaid providers as well as a part of the assistance. They've taken care of Medicare, they've taken care of hospitals, not so far anything for Medicaid providers. So please share with whoever you need to share with. That NBCSL is very much interested in having some advocacy done for Medicaid providers. Okay? All right.
Yes, ma'am.
Well, yeah.
Thank you.
Okay, thanks. And if we get back around to you, Erlinda, and if you've got some specific ideas about what we need to do to make sure that message gets sent up the chain, we'd be more than happy to do that. Now, it is my pleasure right now to introduce you. Now, the title said the money. Now, Erlinda and Erica and Ms. Nightingale are public-private employees. They don't have the kind of money that this young man has. Let me introduce you, if I may, to one of our active members of the Corporate Roundtable, Mr. Ramon Looby from Bank of America. Ramon, thanks so much for being here today, and please share in your own way.
Thank you, Madam President, and it's an absolute pleasure to be here with you in this distinguished panel. And, you know, as I was preparing for today's remarks, I just really, you know, thought about just the history that I have personally with NBCSL. I've been a member of the Corporate Roundtable for more than a decade, maybe going on 12 years now. And I think about the relationships that I've made with members and just how tremendous they have been in shaping my career and shaping public policy for the betterment of our community. So I just want to recognize you, Madam President, for being one of the longest tenured folks that I know here at NBCSL. It means you're seasoned and great. So I just truly
you're so good, Ramon.
Absolutely. So today I don't want to go back over Erlinda's presentation, which was perfectly put together around CARES and the different phases. But what I will do in my presentation is focus on what she deemed as or dubbed as phase 3 and 3.5, basically the CARES Act and then the reauthorization of the PPP. And so let me just stop. I actually, we had a little bit of difficulties earlier on my end, and we weren't able to share video with you. I am told that it'll be shared along with the presentation on the website, so feel free to go take a look at it. I thought it was really well done by our team. So before I get started, and I don't see my presentation up just yet. I can get that to come.
Wayne
Before we
is
get started,
working on it, Ramon.
listen, Wayne's good. I like it. All right, let's go to, okay. So before we get started on CARES, I want to just sort of walk through and sort of set expectations, right? I want to make sure that I'm able to talk broadly about how we've, as an industry, dealt with helping folks who really need help right now. And part of that was being one of the main drivers and main deliverers of government aid through CARES and the CARES Act. So I'm going to touch on some acts specifically, give you some numbers, and really just sort of give you really the size and scale of what's had to happen. It's no mystery to anyone. Unemployment has really just skyrocketed here in the last month and a half. That comes with a shutdown of the economy. But one of the numbers that sort of stick out to me was the April number, in which unemployment rate jumped 10%. It was the steepest climb on record. And even going back to the Great Depression, it took many years for the unemployment rate to really reach that level. So, this was, as people talked about unprecedentedness of this crisis, as it affected lending markets, as it affected financial markets, as it affected the economy as we know it. I want to tell you a little bit about what we as Bank of America, how we've responded, and how our peers, many of our peers, and another point I just want to start make before I get into my presentation is I'm one of many CRT members who represent the financial services industry, and many of my peers, many of our, no matter what the size of the firm, financial institutions are stepping up right now to help clients who need it. So Wayne, if we can sort of get into the next slide, thank you so much. And so this has been one of the mantras that we've had from the very beginning. Brian Moynihan, our CEO, has gone out and talked about the fight against the coronavirus as a war, and really leveraging our expertise, our size, our scale, and our connectivity to fight against this war. And that's happened on a number of different levels. And I want to just want to walk through what some of that means for us. So specifically, banks, as the economy closed down, banks never did. Financial services never really closed down because they're essential to ensuring that the economy keeps going. So one thing that we focused on early on was protecting our folks who were on the front line. For us, it's about 24,000 folks who are at more than 4,000 financial centers across the country, there to support and provide services for the frontline workers who are not just in hospitals, not just in fire stations, not just in grocery aisles, but the millions of them that are out there doing the work and need the services. So we've wanted to make sure that we took care of our teammates to ensure that they were ready to meet the need, and walk through that just real quickly. So some of the things that we've done, and I can tell you that this has been done by a number of our peers. We've prepared ourselves to operate in this environment. So we've enhanced our cleaning process. We provided PPE. There's a lot of P's and a lot of E's there. Personal protective equipment. So in the gloves, the mask, to our employees, so they are safe in their working. We've also provided no-cost COVID testing and enhanced our backup care. So schools are out. There's a strain on a number of people trying to think about what they're doing. We try to take that stress and strain around childcare right off the table with an enhancement of our programs around how we support our teammates. So we initiated $100 a day reimbursement for childcare. So teammates, no red tape. If you know someone, if you're comfortable with a family member or friend taking care of, we just reimburse and take care of that. And also, we also provide a special compensation to all of our frontline workers. So the point of that is, I'm telling you specifically what Bank of America is doing. In the context of this, I'm telling you this is what's happening around the financial services world as we all are fighting this. Next slide, please. So as Erlinda talked about the CARES Act and did a wonderful job of going through basically all 3.5 phases of what we've had as stabilization from government or fiscal action. I want to just talk a little bit about 2 of these. As you can see, CARES was passed back in late March, and it was literally the largest bill that had ever passed the U.S. Congress at $2.2 trillion. The economic relief was tantamount to 10% of GDP. That's unprecedented. But I will tell you, coming out of the financial crisis of 2008, policymakers understood that they had to be aggressive to stop further contagion, further contamination of a number of different things in the economy. So they wanted to really stabilize. I think that's the best way to sort of think about it, stabilize the economy as we were preparing to stop economic activity on a massive scale. So two areas I'm going to focus in on are the support for individuals and families, tell you a little bit about what we were able to do to support that endeavor, and then also talk about a little bit about what we did to support also, small businesses through the enactment and the execution on the Paycheck Protection Program. So next slide, please. So here are, go back, there we go, Wayne, thank you. So as we talk about the support for individuals and families, here is a list of, this is not an inclusive list of everything that came out of CARES, but these are pretty significant. Folks are able to have a penalty-free withdrawal from 401k plans up to $100,000. The legislation also deferred any penalty that you might receive, as well as allowed for a 3-year allotment or payment for any income taxes that you might need. So that was one way that lawmakers thought was able to give folks access to funds if they needed them quickly. So Erlinda talked about the unemployment benefits enhancement. I think it's upwards of $600 a week. And I think that goes through end of July. So the piece I want to focus on here is the rebate payments for individuals, couples, and families. This was the $1,200 that was scaled down to $600, and folks were phased out at, I think, around $95,000. Single, I think, up to $150,000 married couples. So this ended up being approximately 160 million payments from the U.S. Treasury out to taxpayers. And so if you think about the scale of making these payments, over 110 million of them were electronic or ACH, and about 50 million were through checks. So I think about 5 million checks coming out of Treasury every week, along with tens of millions of ACH payments. It was definitely something to behold, something to see on the scale. However, for us to get ready for this, to prepare for our clients, our customers, even our non-clients, was, we had to think about, how do we do that in the era of COVID? How, what are the things that we need to think about? Social distancing in our lobbies and areas. Do we have enough money on hand to provide? And also, are we providing the right level of security for folks who are going in and really sort of getting the money that they need, given everything that's going on? So thinking about that scale, that's happening all at the same time as PPP, which I'll talk about here in the next slide. So CARES Act created the payroll protection program. And I know this has been talked about quite often, and you've heard about it on the news and elsewhere. But it's a program that provides direct incentive to small businesses to keep workers on payroll. And it does that by providing a grant, which is a loan, which can be converted back to a grant should the borrower do everything to ensure that. So part of that was using a percentage of the loan to ensure that you kept employees on payroll for 8 weeks. And so I talked at the beginning a little bit about that steep drop, a steep rise in unemployment figures. Small businesses, SMEs, small and medium-sized enterprises are the largest employer in the United States. So this program was literally designed to stabilize this huge workforce. And so to give you just some numbers that just floored me when I heard them, and as we were going through this. So PPP ended up being about $360 billion totally authorized. On average, I have it written down here so I didn't surprise myself here. On average, SBA handles about 50,000 loans at $30 billion annually. So think about that. In less than a month, we, the financial services industry, there are over 5,000 banks that just participated in the second phase of this. We did 20 years of SBA lending in less than a month. And so when you think about responding to this crisis, for instance, at Bank of America, we've moved multiple thousands of employees to help process, to help provide help to clients, to help put this program together and to get these loans processed. And now I'm going to share a little bit about some of our statistics and some of our metrics. We think we've really been able to help a number of people. To date, we've done over 300,000 of these loans, making us the largest small business lender in the second round. And so let me just sort of, next slide. So here you can see a few of the metrics that really stand out and I think show that the money got to the people, that it got to the people who needed it. And so you see 98% of all loans that we provided through SBA went to companies with less than 100 employees. 4 and 5 of those loans went to companies with less than 10 employees. And then if you take a look at the number there, around 83% of all of the loans were less than 100,000. And so I will tell you today, as I took a look at the SBA numbers from, I think, just Tuesday, there's about $121 billion still remaining. And what we're seeing is a drop-off in availability. But I will tell you, there was a portion, there was a time there in April, after about April, the week of April 8th or April 15th, when PPP funds ran out. And, it was really a tenuous time for our clients and customers who were really at wit's end and thinking about not just their businesses, but really thinking about their employees. I had conversations with numerous of my friends who are either entrepreneurs or own their own business, and just really the fraughtness of these conversations just detailed what we were living in. And so once Congress reauthorized the second amount of funding, we saw a smoother process. SBA was able to actually shut down their system for all banks and only allowed small lenders at certain periods to come in and say, upload to SBA, we'll get these decisions turned around to you so we can get that money out the door. And it really spoke to us as an industry stepping up and saying, this is the time that we need to support. If none other, we need to get out in front and support. Next slide, please. So I talked a little bit about government programs and what we've done from a Bank of America standpoint and broadly as an industry, because you can go to any of our peers, any of our smaller or regional peers, as well as state chartered banks, and many of them are providing something just like this, which I'm going to walk through, but each one will be able to tell you in their own terms better than I can, but I can speak closely to Bank of America's program and what we're doing for our 66 million consumer and small business clients. And we're working on a case-by-case basis. If folks are having issues or facing difficulties, we encourage them to reach out to us. We want to work to help. And so here you see just an example of some of the things that we're doing. Whether it be, clients can request refunds for NSF fees, early withdrawal penalties for CDs, small business loans, clients can request deferment payments, as well as refunds on late fees, and so on and so forth. Next slide, please. And so just to give you some idea on who, the uptake in this program, just over the last few weeks, we've been able to help more than 1.6 million of our clients through this program we just talked about, what I just explained, and we know that we're going to be able to help more as this plays out. We understand that this is the business cycle, and as folks are opening back up and the economy is slowly creeping out of the depth of the fall. There's going to be some not necessarily a straight up and down recovery. There's going to be some struggle there. So we're going to stand with our clients and our customers and be able to help them in this time. Next slide, please. And then just this last slide here, as I anticipate some questions. I just want to just highlight what financial services firms are doing in return in regards to responding to this unprecedented crisis, whether it be helping local communities, whether it be supporting infrastructure or critical needs or essential workers. We're really determined to ensure that we're doing our part to help our communities and our clients and our teammates get through this. So just a few highlights from a Bank of America standpoint. We've committed an additional $100 million of support to address pressing needs related to the coronavirus. I will tell you, this is on top of the $250 million that we provide every year. And let me just stop for a second there and give you some examples of what I'm talking about there. To date, we have allocated about $90 million of this fund. 55 million is already out the door. And I just want to give you just two examples of how, we're thinking about impacting folks here. So in Atlanta, we've donated about $500,000 to Grady Hospital to help support their testing facilities. Here in Washington, D.C., we've donated $1 million to Howard University Hospital to help them set up in wards 7 and 8 testing facilities for areas that are hardest hit or hardest impacted by coronavirus. And so it's really something in all of our 94 markets. We're looking locally and regionally to provide that support. Last thing I want to touch on is that we're providing $250 million in capital to community development financial institutions. And these are financial institutions that really help the smallest of small businesses and provide not just money, but technical assistance to help grow that business so that they can continue to grow. And so not only did we provide the $250 million in capital for the loans, but we also provided $10 million through philanthropic grants to ensure that they had operating capital as well. So I really appreciate the opportunity to share this. Next slide. At any time, if you have any questions or if I can be of any help, please don't hesitate to reach out to me. And I've been here for questions. Thank you so much.
Okay, thank you so much for that, Ramon. We appreciate it, and thank you for mentioning that. While we are hearing from Bank of America, the Corporate Roundtable has a number of financial institutions and credit repair agencies as a part of our membership. And so I want to make sure that any of our CRT members out there who may have information very similar to what Ramon has shared about Bank of America and what they are doing in the community, please get that information to us at NBCSL, and we would be more than happy to post that on our website as well. I know JP Chase and Morgan, Chairman Sanders and I had a lovely conversation a couple of weeks ago about their program moving forward, and they were interested in what NBCSL and its members like to see. And one of the questions, Ramon, that came through, and we'll circle back around for you, but there was one comment that, we are talking about all this money, but are we working with credit repair agencies? And I don't know if he's on the webinar, but Bill Cheek has been a very active member of NBCSL's roundtable. And this gives me an opportunity to share with people who are on the call. If you're interested in who we are and what we stand for, please visit our website. Look at the resolutions that we passed through the years at our annual conference, because we have done some on credit repair and the whole use and the role that credit plays. But what I'd like to do now, because what we wanted to do is make sure that you leave this webinar with some sense of direction about what options are out there. We've heard from NCSL and we've talked a bit from the federal perspective of the CARES Act. Ramon has shared from a private sector banking perspective where we are money-wise, but a lot of us represent communities that are vulnerable populations, so unemployment is something that is rampant in our communities. And so I am very pleased at this point to recognize someone who is recently, the institution itself has recently partnered with NBCSL, and that's the Urban Institute. And so we are pleased to have Demetra Nightingale join us to talk just for a bit about the whole notion of investing in and reemploying workers. Because at the end of the day, y'all, that's what it's about if we're going to have a complete recovery. So Demetra, the floor is yours. And thanks so much for joining us. And we are so pleased to be working with the Urban Institute. It's all yours.
Thank you, President Cobb Hunter. It's an honor for me to be invited to speak here today. So I'm very happy to be here today. And I think Wayne is going to put up my slides. I'm going to shift gears slightly and talk about sort of the next phase. We heard from Ms. Doherty and Mr. Looby a lot of detail about some of the actions that have already been taken by Congress. I'm going to shift a little bit and tell you what I think needs to be included in sort of the next step as we're talking about investing in and reemploying workers, because it's a huge issue and a challenge. And as we already heard from Mr. Looby, it's not going to go away very quickly. Next slide, please. This slide gives you a sense of sort of the unemployment rate over time from April 2000 to April 2020. And the top line is Black African American unemployment rate. The middle line, which is sort of tan colored, is Hispanic, and the blue color on the bottom is white unemployment rates. So to give you a sense, the April 2020 unemployment rate was 14.7%. We'll get the next unemployment rate number, which will be for May, on the first Friday in June. So we've got a few more weeks to go. The white and Asian unemployment rate was about, you see in the blue line, that's white unemployment rate was 14.2%. I don't have the line for the Asian, but it is a little bit higher than the blue line for white workers. The Hispanic at 18.9% was the highest in April 2020. You can see over time, though, the monthly unemployment rates from 2000 to 2020, Black African American unemployment rate has been consistently higher, which is, a major problem in this country for sure. The shaded columns that you see in the early 2000s and then to April 2008, those are recessionary periods. And a recession technically means 2 quarters of declining GDP, gross domestic product. So we haven't yet got the data for if we're in a recession now or not. But I wanted to show the recessionary periods here because you can see that even after the recession is technically over, unemployment rate is still going up. So the first recession period in the early 2000s was fairly short. We know that the Great Recession, that's why they call it great, was very long. And the point to bear in mind is that unemployment is still, the rate of unemployment is still likely to go up after the recession is over, and we haven't even gotten the signal that we're in it, although most people think we probably are. The line on the right, which goes straight up, it sort of looks like it's a border to the chart, but it's not. That's the unemployment rate. And so at the very top is the Hispanic rate, and I put the other rates in there so that you can see what it is. So it's just as Mr. Looby said, it's a precipitous rise in unemployment or drop in employment over this time period that we've never seen before. Next chart, please. So I have a little typo up there at the top. We now have an unemployment rate that's 14.7%, as I said. Alternative measures of unemployment rate put the unemployment rate much higher, over 20% or probably even more than that. So there are different ways to measure unemployment rate, but the 14.7 is the official unemployment rate, but it's probably much higher than that. This morning we heard the weekly numbers on the number of people who were newly applying for unemployment insurance, which brings the total over the past 4 or 5 weeks to over 35 million new unemployed. When I prepared these slides, it was over 30. Now we're closer to 35 million. The Black and Hispanic unemployment rate is generally higher than white and Asian. All of the industries are being affected, and in this high period of unemployment, maybe recession, women's unemployment rate is particularly high. And some of the reasons for that could be sectoral, so that we've had very high rates of displacement in services, retail, food sector because of the shutdown. So the unemployment rate is going to decline, but probably not all at once, as I showed you on the previous chart. And the nation, and this is the main point that I want to talk about today, I think that the nation will probably need, and there's already a lot of noise, a major jobs program. And in that case, I think it's important for states to begin at least thinking about a jobs program, even though Congress has not technically passed it yet. Next slide, please. So possible investments in workers for the recovery include really two types of investments. One is investing on income, which we've heard about through unemployment insurance, and also retraining. And what I wanted to talk about was a possible federally subsidized jobs program. And public and nonprofit community-based jobs could be subsidized by an infusion of funds by the federal government, and I'll talk in a minute about how much I think might be needed. And they could provide useful community-based services in the public health area around maybe screening and tracing and public safety and social services, community services, technology, or expansion of technological access to people who don't currently have it. So things that would help the community. A federally subsidized jobs program at the community service jobs could be targeted to unemployed people. The second type of a subsidized jobs program might be public, private, or nonprofit jobs plus training. So to incorporate training for some of the jobs that are expected to be more common in the future. Many people are saying, not just me, we're probably not going back to things just the way they were before, and that we need to think now about the new kinds of jobs, whether it is more remote work, more teleworking, more telehealth, technology, using technology in sort of routine ways. How many of us were Zoom experts a month ago? I knew about Zoom, but I am now an expert. So that there is a whole new reality that we need to be prepared for, as well as perhaps sustainable environment. One of the surprising and interesting things that's happened during the pandemic is that our pollution rates have declined, and it's raising some more consciousness about the importance of clean environment and sustainability. And so there may be a shift toward more support for those kinds of jobs in the future. I think that second type of subsidized jobs that has retraining incorporated into it should have priority for low-income workers and for new workers, young workers, whether they're just coming out of high school or college, and giving priority to small businesses. So a federally subsidized jobs program then could have sort of a two prongs. One would be community service jobs for people who are unemployed to provide useful community and public services in the public and nonprofit sector mainly. The second prong of a subsidized job program could include subsidizing jobs in the public, private, and nonprofit sector, but to include training as well, training and retraining. One of the things that we've learned over the years is that there is an important role that these kinds of subsidized jobs can play in terms of expanding opportunities for workers who perhaps have not been able to get into training programs in the past. In addition to federally subsidized jobs program, the other major way that jobs could be created is through, as we've already heard from Ms. Doherty, the investment for infrastructure spending. And this could include jobs that would mostly be in the private sector, whether they are environmental sustainability or broadband development or roads and transportation initiatives. The infrastructure spending creates a huge number of jobs, depending on the investment, if it's trillions of dollars, in the mainly in the private sector. So those are job creation, not exactly subsidized jobs that are job specific. Similar to that job creation would be subsidized on the job training, which some of you may know about, where the local workforce development system, the state workforce development system, can actually subsidize jobs in the public, private, or nonprofit sectors, usually 50 to 75 or 80% of the wages, and with jobs targeted to lower income workers. So an infrastructure spending could incorporate retraining as well as job creation and major infrastructure development. The third type of investment that is important is sort of skills training and education. And with an infusion of funds, not just for keeping elementary schools open, but forgiving federal student loans, but increasing the capacity of community colleges to provide training, maybe in certificate areas around some of the newly emerging technology, and also with apprenticeships that could be in high skilled occupations in partnership with businesses. So each of these have a potential, and while none of the bills that have already been passed, the phase 1, 2, 3, and 3.5 that we heard about, it's possible, we're hearing much more discussion about subsidizing jobs and infrastructure spending. So I would think that over the next month or so, we may see Congress act. In fact, there are just this past week, the House bill that you heard about earlier did allow for the workforce development system funding for adults and youth to spend a certain portion of the federal funding and the additional funding that they propose on what's called transitional jobs, which is a form of subsidized jobs. And there are a couple of other Senate proposals as well that are including discussion or proposals for funding, federal funding for subsidized jobs. Senator Booker, Senator Harris, Senator Baldwin, and others have all spoken, written, and drafted possible legislation in that regard. So I would think, even though we haven't got the funding for it now, it may be coming. Next slide, please. So I use the term subsidized jobs. I also mentioned transitional jobs. There's a long history that we can draw lessons from in about subsidized employment. Starting in the 1930s with WPA, 1970s, for those of you who are my age, would remember the CETA programs, which in fact, CETA, subsidized employment, was a major source of professional development in the Black and Hispanic community, Black especially, in terms of building public policy skills and also in tribal governments, where some of the subsidized positions were able to lead toward professional development that ended up at national foundations and graduate schools all across the country. The Milwaukee New Hope program in the 1990s not only subsidized employment, but had filler jobs where if people couldn't find a full-time job, they could be a subsidized part-time job, and people were guaranteed a wage supplement that would bring them up to 150% of poverty. So those were some of the earlier ones. What do we know? We know that there are positive benefits to workers in terms of income, at least during the period of the subsidy. And if training is integrated in, new skills that can be in demand, as I said. There are also positive benefits to families in terms of stabilizing income during a difficult time, which also helps mental well-being. And we know from the Milwaukee New Hope evaluation, which was rigorously evaluated, that there was increased child well-being as well, we think because of the income effect and the stability effect. And there are also, as I mentioned, positive benefits to the communities, providing useful public services that otherwise would not be possible, into the nation in terms of expanding skilled workers. Next slide, please. I'll finish up. A few more lessons. We need the multi-pronged approach. It can be pretty costly. Approximately 1 million jobs a year might cost $30 billion, but in the scheme of 3 trillion, it seems to me that might be a good investment. But the big caution is that subsidized jobs are not easy. They need careful thought and careful planning, and the details matter. 3 suggestions, 3 recommendations, I would say, based on lessons. The wages should be set high enough to support a worker and a family, but not so high that it's a disincentive to get a regular job. Second, the jobs should not replace regular workers or violate any of the laws like equal opportunity, non-discrimination, occupational safety, or collective bargaining by unions. And then third, the federal funds. This is critical because when you have a whole lot of infusion of funds, there's always a little risk of some fraud going on. Federal funds should add value, and that the policies in the states and the federal government need to guard against businesses, for example, that might hire people that they would have hired anyway, or that the new funds should not be supplanting other available funding. So there are challenges there as well. Okay, next slide. And this is my contact information. The Urban Institute has lots of resources. You feel free to give me a call anytime or send me an email. And I've put links to some of our COVID web pages, as well as our employment and jobs programs web pages. Thank you very much.
Great. Demetra, thank you so much as well. And quite frankly, you provided us with a segue to our last presenter, Ms. Erica McKellar, who will talk a bit about state funding and what all of this means for state budgets. But before I recognize her, I just want to make sure that those still on the call heard a couple of points that you made as far as the jobs piece. A part of why we wanted you on here is we want to return not to normalcy where workers are underpaid and barely surviving. We want a new paradigm, and we are hoping that this partnership and relationship with the Urban Institute will help us fashion something that can be presented to Congress as far as ways to go. The other piece of it, though, is we are state legislators, and we recognize that devolution means the power is at the state level. And so the message from your presentation that I am hopeful some of our colleagues have picked up on is that in most of these states, they've created these committees to talk about where do we go from here, how do we reopen, and all of that. And what NBCSL wants its members to gain from that conversation is we got to have a plan. And so if you are a part of a committee at the state level that is looking at returning to work and reopening for business and all of that, please recognize that whether the feds do it or not, we as state legislators, in honor and obligation to our constituents, we've got to talk about the necessity of creating a jobs program in the 3 areas that you talked about. Contact tracing is one that everybody's talking about now. It's low-hanging fruit. It's something we can move forward on. But I just want to make sure that my colleagues didn't miss a part of your presentation, which is we've got to be about creating some jobs in a variety of ways. And if the feds don't do it, we can't just say, oh, woe is me, and not try it. So thank you so much. And our staff is going to be reaching back out to you, because the other question that has come up is this notion of how active should NBCSL be in working with various state legislatures about regulations and unemployment insurance compensation, which says if I offer you a job and you say no, then tough tookie. You are not going to be able to draw unemployment. But I digress, Miss Erica McKellar, who is there and ready to talk to us about what all of this means for our state budget. Because at the end of the day, y'all, we are state legislators, and we're going to have to make some real tough decisions. So, Miss Erica, tell us how we're going to do that.
Well, first, I just want to thank you all for the opportunity to talk with you. I think we here in the Denver office of NCSL are really trying to, keep tabs on, this really fiscal crisis that states are frankly facing, and trying to, get a handle on the magnitude of the problems that you all are facing. And I think, Wayne, if you want to go ahead and get my slides started. So, I in some ways feel like I'm on the wrong webinar. The topic is where is the money, and unfortunately, a lot of my presentation is about the lack of it. This is just kind of a high level overview of what we're hearing from the states. I know you all are really on the front lines of the challenges that you all are facing, but hopefully, some of this information can at least let you know that, everybody is facing a lot of the same challenges. We're all in the same boat here. Are we having some technical difficulties with the slides, or?
Erica, if you want to just continue with your presentation. Wayne
Yeah.
had us all psyched out because he's got that picture of him, and earlier I kept waiting for it to move and nothing happened, so it dawned on me that's not really him.
No worries, no worries. I'll get started. So, some of the most immediate actions that we saw states take in response to the COVID-19 crisis were supplemental appropriation bills. Currently, about 27 supplemental appropriation bills have been enacted in the states, largely to health and human service agencies and to education programs. Folks really on the front lines of this pandemic, making sure they had the resources they needed to combat this virus. A number of other supplemental appropriation bills are moving through legislatures, and a lot of those have to do with business relief. We've also seen states start to authorize transfers from their rainy day funds. Currently, 10 states have authorized transfers from their rainy day funds. And we expect that trend to continue. A number of states have already adjourned or have suspended their sessions for the time being, so I think we'll see more of that moving forward. Next slide, please. Obviously, there is a lot of uncertainty right now facing states. We are trying to get a handle on the magnitude of revenue loss that states are facing, but there are still so many unanswered questions. States are starting to reopen, but we don't really know what that looks like. We don't know how quickly consumers will return to businesses. We don't know how soon some of these jobs will return. We don't know if there'll be a lot of pent-up demand from consumers or if there'll be a second wave. So, it's always a tough job to be a revenue estimator, and I think that job is especially challenging right now. States are also facing some difficulties accurately estimating revenue because of changes in tax filing deadlines. A lot of states have changed their tax filing deadlines to July 15th. So funds that states had anticipated having during the fiscal year 2020 are now getting pushed into fiscal year 2021. So creating some uncertainty there and some cash flow challenges as well. Next slide, please. We're really just starting to see some of the first official revenue estimates come out. A lot of states are sort of waiting to get a better handle on, what the tax returns will be for April and May. But informally, from a lot of the legislative fiscal staff around the country, we're hearing that states are preparing to have about 15 to 20% less revenue than they anticipated, which is a huge and catastrophic number. Some of the early estimates that we're seeing, California, the three major tax categories could drop 25% over the next 14 months. My home state here in Colorado, we're facing a $3.3 billion shortfall, which is equal to about 25% of the state's general fund budget. Kentucky, like many states, did some different scenarios, and in their sort of control or more optimistic scenario, they're projecting a decline of 10.5% for fiscal year 2021. Maryland could see a 15% drop in revenues just between April and June. So really, devastating numbers for states. I think states are going to face a lot of challenges moving forward. Next slide, please. So obviously every state is seeing a significant impact on their budgets from this pandemic and from, you know, the essential economic shutdown that that states have seen over the last couple of months. But a few states I think are particularly vulnerable or facing, you know, other external challenges that are going to make the recovery challenging. States that rely on oil production, I think, are especially vulnerable. You know, Alaska recently revised their revenue estimate to assume $40 for a barrel of oil. Louisiana's current budget is based on oil being $59 a barrel. You know, we've seen the price of oil rebound in the last couple of days. I think it's currently at $30 or $35, which is closer. But a couple of weeks ago, the price was negative. So, you know, they're facing a lot of volatility and uncertainty in a major revenue stream there. And if that trend continues, I think they will face some extra budget difficulties. States that rely on tourism are especially could face some prolonged challenges. You know, 1 in 3 workers in Hawaii is unemployed, about 37% of their workforce. You know, and I don't think we really know when people will start traveling again, when folks will feel comfortable doing that. So they could face some prolonged challenges there. Next slide, please. You know, as we saw during the Great Recession, and we always see during times of economic downturn, demand for social service programs increases. We'll see more folks eligible for Medicaid programs. You know, 36 million Americans are drawing unemployment benefits. So, you know, states really get squeezed from both ends during these challenging times. Not only are revenues down, but, you know, but citizens are looking for more services. So that's always a challenge for states to balance that. Again, like we saw during the Great Recession, we're starting to see states discuss how they're going to cut some spending. Typically, we see kind of across the board cuts and spending freezes as sort of the first mechanism. You know, Georgia's asked agencies to prepare for 14% cuts across the board. Utah is asking agencies to prepare 2%, 5%, and 10% scenarios. So I think we have started to see even more states doing that, and I think we'll continue to see more states start to plan for those types of cuts. Next slide, please. Obviously, you know, this pandemic has also just created logistical issues for states. You know, it's happened during the time when most states are in session and completing their budgets that start for the most part on July 1st. Many states had already passed a biennial budget or fiscal year 2021 budget when this whole thing started, largely using revenue estimates from, you know, December and January. And obviously, that picture looks completely different now. So many of those states will have special sessions to address these issues. About 18 states are still working on their budgets or waiting for actions from the governor. And obviously they too are looking at a different picture than I think when sessions began. We're seeing states take some measures that we don't typically see, some continuing resolutions. New Jersey extended their fiscal year. States kind of enacting base budgets or what they're calling bare bones budgets that they can then go back and address later. So, you know, I think this is really affecting just the logistical work, and, you know, passing a budget is never easy in a normal year. So, you know, this is definitely creating more challenges. Next slide, please. A little bit of good news. You know, states really built back up their reserve funds since the end of the Great Recession, which could hopefully help soften the blow a little bit. You can see this shows state year-end balances, the percentage of state general fund spending. We typically at NCSL like to look at year-end balances versus just rainy day funds. Year-end balances is a state's closing balance plus their rainy day fund balances. So carry funds plus rainy day fund balances. You know, in 2019, states had about 11%, close to 12% in reserves on average. So, you know, hopefully that will help mitigate some of the Sorry, I thought someone had a question. So we hope that that will help states a little bit. Next slide, please. The CARES Act has been talked about extensively. Some more good news for states. The CARES Act provided $150 billion to state, local, and tribal governments, which is great, but there are some challenges for states with this funding. Who has authority to allocate these funds? That was a question that I believe has come up. The answer is it depends on the state. If the legislature's in session versus out of session. We have a couple of tables that I will share that address, unanticipated federal funds in general. And we at NCSL are tracking or trying to get a handle on, the mechanisms that states are creating for allocating these funds specifically. And I'd be happy to share what we have on that as well. We are seeing some arguments in the states over this in legislative versus executive branches, so we're trying to keep a handle on that as well. As it's been mentioned, this money has to be used for COVID-19 related expenditures, and I think states are really still trying to get a handle on what some of those allowable expenses will be. We're seeing some states kind of hold on to that money for now, or parts of it, waiting for further guidance from Treasury, and hoping that there might be congressional action that allows more flexibility and allows them to use that money for revenue losses. And the other challenge is that these funds must be spent by December 30th. So states, I think, are really quickly trying to get mechanisms to track and report these funds up and running. A number of states, I think, had hoped to use this money to expand broadband to rural areas. But unless that can be done before December 30th, that won't be an allowable expense. So, I think states are facing some challenges there. Next slide, please. So that's really all I have to share. I know this is not a happy picture, but every state is facing the same challenges, and we know organizations like yours and NCSL are hopefully helping each other share ideas and share ways that we can all move forward. If there's anything that we at NCSL can do, we would love to hear from you. I've got our website here and my contact information, so please feel free to get in touch with us. We're happy to do anything that we can to help make your jobs a little bit easier. So please feel free to reach out to me, and if there are any questions, I'd be happy to answer those.
Okay, thank you so much, Erica. And Erica, you mentioned that you felt like you were perhaps on the wrong webinar. And from a staffing standpoint, we kind of felt that way as well, because we came up with the title. At the time we came up with it, it sounded real cute and that we get a lot of people in. And as we worked through it and got all of these fine presenters on board, it was like, well, we didn't really talk a lot about how to access the money. We talked about the money, not a lot of detail about how to get it. And so for those of you who are still on, please know that we are continuing that conversation at the staff level, and that we will post on our website anything that we come up with as far as strategies. But y'all, you're legislators. You know how this works. You need to be back in your states now, having conversations with your governor about how the money is to be spent. Erica, thank you for making that point about the argument about whether it is an executive or a legislative responsibility to spend the CARES dollars. For those of you who have not gotten engaged in your state about who should spend the money, the governor or the legislature, please get engaged, because that's critical and important. And it allows me to share with you that NBCSL is partnering with the National Governors Association. We are pleased to have that association. We've already seen in some of our states the results of that partnership. But I'll close with these comments. This whole endeavor has been kind of, as one person put it, it's like building a car and driving it at the same time. All of this is evolving. And so what we at NBCSL would ask of both our membership as well as our corporate partners and our labor partners is let's keep the lines of communication open. Understand that we're all in this together and we're all learning, because I am not being partisan when I say this, but there doesn't appear to be much leadership at the executive level. So we've got to figure our way through all of this. But know that NBCSL is there trying to help you do that. Our priority is, of course, the constituents we serve. For a lot of us, that means vulnerable and underserved communities of color. And NBCSL is committed to doing this work. You have been a part of the second in a series of webinars. As I said at the outset, our next one will focus on education. We want to have a conversation about, is it safe for us to have our kids back in school in the fall? What do we do with our higher ed institutions who are bleeding money because they've got to give back refunds and all of the issues that our higher education institutions are facing? And when we talk about higher ed, what about HBCU? What is on tap for them? So there is still a lot of information. We at NBCSL are committed to trying to increase your awareness, because at the end of the day, as a solution-driven organization, we don't have all of the answers, but we want to provide you with enough information so that you'll at least know what questions to ask. Closing comments, if I may. There is a survey that when you click out of the Zoom meeting, please take the time to fill that out, because it will help us improve future webinars. If you have questions that we didn't get to, and we tried to weave those questions in during the conversation, but if there are questions that did not get answered, please email those questions to director@nbcsl.org, director@nbcsl.org, and we will get those answers posted. Thank you so much for being with us, and have a great day. Most of all, please stay safe, stay well, be blessed. Take care.